Hi, my name is Dr. Jeff Feenstra with Pro Chiropractic, and what I want to talk to you guys about today is I want to show you a couple of different things that we do here in the office for numbness and tingling going down the arm. Sometimes the tingling can start in the neck and kind of work its way down into the arm and hand. Sometimes it starts in the hand or the elbow and kind of works its way up. We can call it different things, whether it's thoracic outlet syndrome, carpal tunnel syndrome. Those are treated a little bit differently depending upon the source of the pain, source of the numbness. But I'm just going to show you a few things of how we treat that, where that's coming from. Very typically in an exam, we'll take some x-rays to try to determine what the posture of the neck looks like. If there's any loss of that natural cervical curve, that loss of curve can kind of put some tension into the different nervous system structures and some traction, and that can create the tingling. And so we want to make sure we address that with different exercises and things like that. From a treatment standpoint, a lot of times what we'll do is we'll do some adjusting on Michelle's neck. We'll adjust in those areas to try to free up that mobility. And then we'll also do some soft tissue work kind of in the neck, down the arm, into the shoulder, elbow, wrist. And so that's what I want to show you today is some of those soft tissue techniques that we use to free up those structures and create some more space for those nerves. Because very typically, from a postural standpoint, as Michelle's shoulders come forward, this area, this triangle of muscle here, where those nerves come out and those blood vessels come out, gets very shortened, gets contracted. It puts a lot of stress and pressure on the nerves, on the blood vessels, and that's what creates that tingling. And so the biggest thing that we need to do is we need to start to help her with her posture and then release those tightness and those adhesions in those areas. And so one of the things that we'll do is we'll kind of find these points of adhesion, and then I'm just going to take Michelle through kind of an active stretch while I'm applying pressure to some of those areas. And so I'm going to have Michelle turn her head all the way to the left, and I'm going to have her rotate to the right and down. And we'll just do a few passes over that just to create some stretch, create some space. A lot of time this point will actually even recreate some of that numbness down the arm, and those are the points that we're looking for. And then we'll get in here into the more in the front of the neck where those nerves come. We're going to switch that. We're going to have her start here. I'm just going to have her tip back. We're going to find those points, do some active stretching. Not a lot of pressure in here because this is kind of a sensitive area. And that creates a good stretch and releases that. And then we work our way down into the shoulder, and similar thing, finding these points of tightness, and I'll have Michelle start back and then reach up and across. And she's just going to do that a few times, and we release this posterior shoulder capsule. And that allows that shoulder, as that shoulder comes forward, this capsule gets really tight. So as that shoulder starts to roll forward, that starts to get tight. So we want to make sure we release that. And then same thing, where her pec attaches in here, we'll reverse it. Come back, really stretch that. Back, really stretch that. And so what that does is that starts to help her to be able to, as we're doing exercises, that's going to support what we're doing from an exercise standpoint, to where she doesn't have this tightness and this adhesion, and give her some relief from that numbness and tingling down the arm. So whether it's carpal tunnel syndrome, thoracic outlet syndrome, like I said, the treatments can be very similar. We're just going to find those points of adhesion where that nerve might be caught and irritated and entrapped all the way down that arm, and work those points out. Lots of other good videos on our YouTube channel about these types of things, the exercises that we do to help with that loss of cervical curve in the neck. Facebook page has a lot of good information. Go check us out there. Dr. Jeff Feenstra with Pro Chiropractic.